All right. Hi, everyone. My name is Nathan Rodke. I am the Healthcare Campaign Director at Washington CAN, and I'm the co-chair of the Healthcare is a Human Right Steering Committee. I would like to welcome everyone to our winter general meeting. Thank you, everyone, for being here. It's my pleasure and honor to introduce Mohammed Shadane from the Somali Health Board. Somali Health Board is a member of HCHR. Shadane is also a member of our state's Universal Healthcare Commission and an important leader in his community. Mohammed Shadane is going to convene the meeting and do our land acknowledgement. So thank you, Shadane. Take it away.
Thank you very much, Nathan. Thank you. I was trying to figure out how to unmute myself. And thank you, everyone. It's great to be a part of the healthcare is a human right and the work towards healthcare justice for all. First, it's very important to acknowledge and to ground ourselves in the history of the place where we are gathered. We are meeting on the ancestral lands and traditional territories of all tribes of Washington. Most of us in proximity to the Coast Salish people. In Seattle, we are on unceded Duwamish land, stolen land that was never relinquished through treaty or sale. As we discuss universal healthcare, we must recognize that the very foundations of the American medical system were built on the exclusion and displacement of indigenous people. We honor all Washington tribes who have persisted as stewards of this land, and the Salish Sea who have persisted as stewards of this land and the Salish Sea since time immemorial. This, despite the ongoing injustice of lacking federal recognition for many, a barrier that creates significant hurdles for tribal health and sovereignty. Our fight for healthcare justice is incomplete if it does not include the fight for decolonization. We commit to moving beyond just words by supporting Indigenous-led health initiatives and acknowledge that health includes the restoration of land, water, and traditional lifeways. Please join me in a moment of silence to honor the ancestors, the elders, and the current members of all tribes who continue to live. Thank you for joining me for the silence to acknowledge everything that I've said, and then I'm going to toss it back to my great friend Nathan. Thank you, Nathan.
Thank you very much, Shadane. I also want to take a moment to say how much we appreciate you, how much we appreciate the Somali Health Board, how much we appreciate the Somali community, and all communities of immigrants who bring so much life and vibrancy to our country. Right now, we're seeing it with the worst of our opposition. I don't even want to name them. They seek to divide us. We're seeing it with the attacks on the Somali communities today. That effect is not just happening in Minnesota. It's happening in the Somali community here as well. In childcare centers, it's happening to low-income workers and undocumented people. And us standing up for healthcare justice, it means communities standing together. So, we can't do that without recognizing our shared rights, our health, our prosperity. They're all cornerstones of what we want our country to be. So thank you again. Thank you, everybody, for being here and being a part of that. It's now my pleasure to introduce our MCs. First, Carey Wallace. Carey is the board chair of Hawa, Washington. She sits on the Legislative and Health Policy Council at the Washington State Nurses Association. She's co-chair of the HCHR Labor Table, and she's a member of our steering committee, along with Paul Villanueva, who is with the Asian Pacific American Labor Alliance Seattle chapter, and he's a member of the HCHR Organizing Committee and has a Master's of Public Administration at the University of Washington. So thank you very much, Carey and Paul, for being such gracious hosts, and I will pass it to you.
Absolutely. I'm glad to be here tonight. Thank you. In tonight's agenda, we will begin with one of our guest speakers, Senator Rebecca Saldaña, who shared a video to talk about what's ahead in the upcoming legislative session. After Senator Saldaña, we'll hear from the President of Washington Federation of State Employees, Mike Yestramski, who will talk about the importance of solidarity and organized labor in the healthcare justice movement. Then an introduction to our newest committee, the HCHR Labor Table, followed by an update on the HCHR budget by Nathan, followed by our policy committee co-chairs, Hawa Elias of the Community Health Plan of Washington and Max Lau of Children's Alliance. Then we'll vote on the HCHR 2026 policy agenda. And finally, there will be an important call to action. It's a packed agenda. We're glad you're here with us tonight. We will have some good at the order at the end. And with that, I'll pass it to Paul.
Thank you, Carey. Now we will get into our program. First, I am pleased to share a video recorded by Senator Rebecca Saldaña, who could not join us in person tonight. Senator Saldaña is the chair of the Labor and Commerce Committee and a member of the Agriculture and Natural Resources in our state. Here's Rebecca Saldaña.
Hello, everyone. Thank you for all the work you do every single day to make justice real in our communities. I'm Senator Rebecca Saldaña, representing Washington's 37th Legislative District. I'm grateful for the chance to share a few reflections with you today, even if it's by video. As we look ahead to the 2026 legislative session, I want to start by naming the moment we're in. Our communities are facing real challenges, rising costs, pressure on our healthcare system, moral bankruptcy from the Trump administration, ongoing workforce shortages, and growing uncertainty for immigrant families and working people. At the same time, we are also seeing powerful opportunities to move forward together if we stay grounded in our solidarity and collective action. Healthcare justice remains at the center of that work. Healthcare is not a privilege. It is a human right. Yet too many families are still forced to make impossible choices between paying rent, putting food on the table, or getting the care they need. We see this especially in our Black, Brown, immigrant, trans, and working class communities, where systemic inequities continue to shape health outcomes. In the legislature, this means continuing to fight for policies that expand access, lower costs, and center dignity. It means protecting our hard-won gains, strengthening our safety net, and ensuring that no one is excluded because of their income, immigration status, language, or zip code. Healthcare justice is about prevention, about mental and behavioral health, about reproductive freedom, and about honoring the full humanity of every person in our state. As chair of the Senate Labor and Commerce Committee, I also want to be clear. Healthcare justice is deeply connected to labor justice. I am focused on using every tool we have to strengthen worker power, expand the right to organize, and shore up protections for working people across our state. In the face of federal attacks on workers and immigrant communities under Trump, our work here in Washington matters more than ever. This session, we will be looking for opportunities to expand collective bargaining rights, improve working conditions, and ensure workers have a real voice on the job. I am proud to be the prime sponsor of the Immigrant Worker Protection Act at the request of the Attorney General. This legislation is about protecting immigrant workers from intimidation, retaliation, and exploitation in the workplace. It sets clear standards so employers cannot use immigration status as a weapon, and it strengthens enforcement so workers can come forward without fear. We are also working to build a stronger defense for immigrant workers across our state because no one should be forced to choose between their livelihood and their safety. When immigrant workers are protected, all workers are protected. And I will be partnering with Representative Mena and our farm worker unions to pass legislation establishing a state framework for the farm workers to collectively bargain. Farm workers feed our state, they sustain our communities, and they deserve the same rights to organize and negotiate that other workers have. This is long overdue, and I will need your partnership and your advocacy to make it real. Organized labor has always been essential to progress in Washington state. Many of the protections we rely on today exist because workers came together, organized, and demanded better. What gives me hope is that movements like this remind us we are not alone in this work. Change has never come from the top down. It comes from people organizing, showing up, and refusing to accept the status quo. Healthcare is a human right, embodies that spirit, and I'm proud to stand with you. As we prepare for the 2026 legislative session, I look forward to continuing this partnership, listening, learning, and fighting alongside you for healthcare justice, worker power, immigrant dignity, and a Washington where everyone can thrive. Thank you for your leadership, your persistence, and your solidarity. I'm grateful for you, and I'm excited to keep building together. Si se puede.
Now it's my pleasure to introduce Mike Yestramski. Mike is the president of the Washington Federation of State Employees, a member of our HCHR Coalition. He's also an international vice president of ASME, the American Federation of State, County, and Municipal Employees. Mike has long supported the idea of single-payer healthcare system to cover everyone and get healthcare off of the bargaining table. He's been a fighter for values we share here at HCHR and for public service to serve the needs of all Washingtonians. Take it away, Mike.
Thank you, brothers, sisters, siblings. I'm here today as a union member, as a public servant, as a social worker, and as someone who really does believe deeply that healthcare is not a privilege. It's not a job perk. It's not something you earn by luck or job title. It is, in fact, a human right. Every day, right, union members, we keep this state running. We staff hospitals, prisons, schools, ferries, social service agencies. We care for people at their most vulnerable moments. And yet, far too many of us and the people we serve are one illness, one injury, one diagnosis away from complete financial ruin. And that's wrong. And it's completely unnecessary. We know the system we have now isn't working. We see it at the bargaining table. We see it when premiums are going up faster than our wages can keep up with. We see it when our deductibles and our co-pays are forcing working people to delay care, skip prescriptions, or choose between even just seeing a doctor or paying rent. And we see it, especially in our unions, when healthcare is used as a weapon. When employers decide what care you get, when insurance companies will decide what treatments are worth it, and then when workers are stuck in jobs that they can't afford to leave because their family's health is on the line. That's not freedom, folks. That's not dignity. And that's not what working people deserve. And I believe, and we all believe, that single-payer healthcare can change that. That simply means everyone is covered, right? No networks that disappear, no surprise bills, no job lock. You get sick, you get care, period. It means your healthcare card works, again, whether you change jobs, start a family, retire, go back to school. And it means people like me and other union folks, we get to bargain for better wages and safer working conditions instead of constantly fighting just to hold on to the healthcare that we already have. And let's be clear, again, single payer, we're not talking about taking anything away from workers, right? We're talking about taking healthcare off of the bargaining table, out of the hands of the insurance companies that profit by denying care, and putting it back where it belongs, between patients and providers. As union members, I think we understand something really fundamental. When we pool our resources, we are stronger. And that's the principle behind collective bargaining. That's the principle behind Social Security. And that would be the principle behind single-payer healthcare. And for those that are already like, oh, that's too expensive and all this kind of stuff, we already pay. We already pay for healthcare. We pay through expensive premiums, through taxes, through out-of-pocket costs, lost wages. This is not about paying more. This is about paying smarter, paying fairer, and again, making sure that that money goes to actual care and not corporate overhead. As Senator Saldaña mentioned, this is also a racial justice issue. This is a disability justice issue. This is a rural access issue. When healthcare is tied to wealth, to employment, to zip code, inequality, it's not a bug, folks. It's a feature, right? But this is one of the most powerful tools we have to close those gaps. Union members, we know what it means to fight for the common good. We don't just show up for ourselves. We show up for our communities. We believe that when everyone has healthcare, our workplaces are safer, our families are healthier, and our state is stronger. Labor often says that it believes healthcare is a human right. State Labor Council passed a resolution at their last convention My union, WFC, did the same, as have many other labor organizations across our state. Here's the thing, though, that I'm gonna tell folks, and I hope I don't offend people. Talk is cheap. I'm from Baltimore. One of the things we'll hear say a lot is, don't talk about it, be about it. So let's be about it. Let's be bold. Let's reject the idea that this is too hard or too expensive, because the real cost is doing nothing. The real risk is accepting a broken system that puts profits over people. Healthcare is a right, and together in solidarity, we can win a system that finally reflects that truth. So join us, junior union siblings, in this fight, because this is a righteous fight and we will win. Thank you.
Thank you, Mike. We're so glad to have strong voices from organized laborers speaking up for our movements at this critical time. And Mike's not the only one. In 2025, HCHR formed our own labor table, which now regularly meets with the goal of bringing more labor organization into our work for single-payer healthcare. Our labor table co-chairs are with us tonight, Carey, Wallace, and I'll pass it to her.
Yeah, thanks. Richard wasn't able to join us tonight, so I'm going to take his part. For years, resolutions supporting Medicare for All have been passed at Washington State Labor Council conventions, but our labor movement has not yet prioritized the hard work needed to win a universal health plan. Without strong labor involvement and political support, we cannot achieve this goal at either the state or the federal levels. In 2024 and 2025, Healthcare is a Human Right sponsored 2 labor-oriented single-payer summits that resulted in initiatives in multiple union bodies. This led to an adoption of a labor for single-payer resolution at the 2025 State Labor Council Convention. Then we formed a labor table here at HCHR to organize broader active label support for single-payer in the coming campaigns for universal healthcare. The labor table welcomes anyone interested in helping with this work.
Thank you, Carey. Now for a quick overview, Healthcare is a Human Right Washington was founded in 2013 and today remains committed to affordable, accessible, and equitable healthcare for every person in our state and nation. We are growing grassroots movements of community and labor organizations determined to win healthcare and health justice. Everybody in, nobody out. Our work is conducted through our committees, including steering, organizing, communication, budget, and HUX, which is focused on the work of the Universal Healthcare Commission. Today, we are going to hear a lot from the intrepid co-chairs of our policy committee about our common legislative agenda, which we will vote on today. Finally, we are always seeking to build our capacity, and we need your help. If you would like to get more involved in helping move the work of our committees, please reach out to John, which we will put the email in the chat, as well as any of the co-chairs of the committees.
Okay, now Nathan will give us a brief report on the HCHR budget. Super exciting, and the budget committee. Nathan is the healthcare campaign director at Washington CAN. He's also the co-chair of HCHR's steering committee. Take it away, Nathan.
Thank you, Carey. And just a huge thank you to everybody who's been supporting us with your amazing participation in our work. That helps us so much just to get all of this done. You know, everybody knows you can't just do it with that. Like, you got to, like, supporting us financially also helps in a big way. As Carey mentioned, it's helped us put on some really cool events the last couple of years. This year in March, we held a rally for universal healthcare and progressive revenue at the Capitol steps as the legislative session was kind of in full swing, gearing towards a close. We thought it would be good to get folks out there, not just around lobby day, but to keep, you know, that physical presence down there of grassroots activism as things are rolling. So, you know, your support has helped make that happen. Later in the year, we held our state's second, as Carey said, second labor-focused single-payer healthcare conference. And your support helped make that happen, along with organizing the first one. We brought in Roach from Labor Campaign for Single Payer. Her keynote address really energized the audience. Many of those who attended those conferences are continuing to build labor support. And we've also been investing in our communications. Your support funds us bringing people together to organize and collaborate And as we continue to move towards that goal of universal health care, not just on the state level, but on the federal level, we can't do it without both things in action, people participating physically and being with us in our committee work, but also supporting us financially. So thank you for all your support. One additional item, want to really recognize and extend extra great thanks to our newest budget committee members. That is HCHRWA, who is on our pretty much every committee we have, along with steering committee member and organizing committee member Lika Smith from the Pacific Islander Health Board. They've stepped up to help join our budget committee, and they're teaming up with Carlos De La Torre. He's not with us tonight, but he has been there a long time helping us with our budget committee work. And Carlos comes from Labor Council. He's retired, but he used to work their books. So the budget and the budget committee is in really good hands. So thank you for Lika, Carlos, and Cello for helping make that happen. And let's go back to Paul.
Without a doubt, one of our strengths as a coalition is the great work of our policy committee. Here to walk us through our proposed 2026 policy agenda are the committee co-chairs, Hawa, Elias, public policy analyst with community health plans at Washington, and Max Lau, policy manager, health and economic justice, Children's Alliance. They're also members of our steering committee. Here you go, Max and Hawa.
Hi, everyone. Thank you. I will start off by level setting that we are entering the 2026 legislative session in a unique and somewhat tense environment. We just went through 2025, where we saw federal cuts to healthcare and social programs, federal policy and structural changes, and a lot of other harms to health and social well-being. And then on the state level, there is still a budget deficit really based on having less revenue than projected, and it was further enhanced by federal cuts. And the projected deficit is about 2.3 billion through the next year and a half. So really this legislative session, a goal for us is to prevent further cuts to healthcare and safety net programs, which we'll talk more about, and to advocate for sustainable long-term solutions. So with that level setting, we'll talk about this fall. Our policy committee considered pitches from multiple different organizations within HCHR on both federal and state policy items to put on our 2026 HCHR agenda. And the items that we put on our agenda are really guided by our 4 goals, which are here on the slides. Our main goal is to achieve universal health care. That's our North Star and has been for HCHR, but we also want to make sure that we, while we work towards that, we have short-term progress. Next slide. So as the organizations prepared pitches, we asked them to consider 3 questions. The first one being, does this issue enhance and support the mission and goals of HCHR? So we have, I'll put the filtering document in the chat so you all can follow and see what that looks like. But we have organizations specify which goals their policy item aligns with. And the second question we ask is, does this issue have a critical mass of advocates, including a core leadership of organizations within HCHR? And then lastly, is there a clear and realistic strategy to pass or adopt the policy proposal? And this is really just to ensure that the policy items are well aligned with our goals and they're ready to be on the HCHR agenda. Let me put it in the chat. So here is what our filtering document looked like. It might be helpful to follow along as we explain some of the things. And then I just also want to highlight that during legislative session, we'll continue to be adding things that we might be tracking and following, and we'll follow the same criteria of asking these 3 questions and discussing as a policy committee. Next slide. I'll pass it to Max.
Yeah, just echoing really quickly what Hawa said earlier about this being a relatively unusual environment for us to be advocating for healthcare and for universal healthcare in particular, but by all means, that there's no reason to hold back from what we're asking. So with that, we can dive into the first goal of our policy platform, that being achieving universal healthcare and making meaningful progress towards that. For each goal, I will say, for all four of these goals, we will discuss state policies, federal policies, and then non-legislative items. So that includes things like budget advocacy, rulemaking, agency work as well. And then we'll provide a couple of examples of each of our agenda items, but want to reiterate that this is very much going to be somewhat of a living document this year, I think, just because it's so difficult to assess what does and doesn't have legs, what the political appetite is for each item, and there will likely be a need to react and adjust as we get further and further into session. Many of these are also legacy items from last year's agenda, so some of these might be familiar to you. Our first item is continued support of the many pathways toward universal healthcare. Obviously, this is HCHRWA's primary goal and one that will continue to be a high priority for us, even in the face of challenging budget environments. This includes the Washington Health Trust, a publicly funded nonprofit health plan for individuals to enroll in that's spearheaded by Whole Washington, so we appreciate their continued support for that item, as well as work to deprivatize Medicaid and other state-managed health plans. And another example is Senate Joint Memorial 8002, supporting a leveling the playing field between Medicare and Medicare Advantage. Additionally, we are advocating for protecting public health infrastructure in a number of ways, including preventative services and access to things like vaccines, especially in response to some of the federal guidelines that we're seeing in the last month or two that threaten to decrease access. At the federal level, we are supportive of congressional efforts to create universal healthcare systems. So that includes the Medicare for All Act, as well as efforts to grant states the authority to do so, such as the State-Based Universal Healthcare Act, which you may hear us refer to as SABUCA. And then for non-legislative items, we're supportive of the pursuit of universal coverage through the Universal Healthcare Commission, which does include some polite pressure and deadlines for that group. Next slide. Our second goal is affordability and access, which are core to the values of HCHR and fundamental to all the work that we are doing to ensure healthcare is as affordable and accessible as possible, both at the state level and the federal level. Starting at the state level, one of our top priorities is ensuring availability of affordable coverage. So this includes cascade care savings, passing the Medigap Guarantee Bill, and allowing the exchange to adopt certification criteria. Ensuring equitable access to care, this includes reproductive care, and an example is a bill to restrict corporate influence on medicine and improve consolidation transparency. Those are actually two bills, sorry. Additionally, ensuring oversight of healthcare spending. An example of this is a tax on excess insurer reserves and expanding access to public coverage options, including PEB for session employees and maintaining coverage for people who lose healthcare or health coverage as a result of HR1 passed last summer. Additionally, we're advocating for better drug affordability for life-saving medications and supporting patients by alleviating medical debt wage garnishment. Next slide. For our affordability and access goals at the federal level, we're supportive of premium affordability. So that includes things like the enhanced premium tax credits, which, if I recall correctly, were not renewed. I think I saw that kind of over the holidays, as well as reducing barriers to care and admin burdens, such as prior authorization rules, especially for seniors, improving drug affordability by capping costs for medications such as EpiPens, inhalers, and insulin, as well as continued work monitoring the efforts of the Healthcare Cost Transparency Board and the Exchange's Cascade Care Work Group. And I'll pass it back to Hawa.
Next slide. So goal 3 is advancing equity and addressing social determinants of health. And we do consider equity in all of the work that we do. However, this goal highlights the importance of having more targeted efforts to address disparities. On the state level, we are wanting to preserve and advance health coverage for immigrants. That has been slashed a lot on the federal bill, and we saw that it may look different in the governor's proposed budget. It looks different. It looks more limited benefits. So wanting to make sure we continue to advocate for Apple Health expansion. And then also wanting to reduce the burden and impacts of healthcare costs, particularly with credit reporting of medical debt. And then third, ensuring data safety and privacy for immigrants and people accessing reproductive and/or gender-affirming care. The non-legislative side, which also merges with the federal, is that we are monitoring the different rulemaking that's coming out and following the lawsuits. There has been things like CMS data sharing between HHS and and CMS, and the reinstatement of public charge and the PROARA bill. So lots of different rules that we're tracking there. Next slide. Next slide. Next slide. I think the slides probably got rearranged, maybe.
Hold on. Okay.
Goal
Go
4.
ahead. Sorry.
Okay, yes. Okay, moving to goal 4. It is to defend access to healthcare, particularly with our existing public programs. And on the state side, we are supporting progressive revenue to prevent cuts to public programs. And there are a few different proposals that we are tracking and supporting. You can see what they are here: the financial intangibles tax, which is also known as the wealth tax, the high earners payroll tax, tax on insurers' excess reserves, capital gains tax changes, and employer fair share contribution. That one is particularly about employers paying for their employees' health coverage if they are on Medicaid. And a lot of these are on the tracker that we put on in the chat. So if you want to read the details, you can check that out. We also are wanting to defend programs that have been really critical to individuals and families, including paid family and medical leave. We think that's really important to have that safety net at this time. And then lastly, we are part of wanting to protect safety net programs is thinking about ways that we can free up funds and administer programs more effectively, including the Washington Apple Health program. Okay, next slide. On the federal level, the first bullet is a really long typo, so apologies there, but wanting to defend original Medicaid against privatization that is an item that we have put on our agenda year after year, and we continue to support. And then limiting restrictions on access to care and Medicare, including the usage of prior authorization to delay or deny services. There is a federal bill on this. And then the other federal bill is keep the billionaires out of Social Security. And we're supporting that to safeguard the Social Security program. And then we'll continue to advocate against impeding changes to Medicaid. On the non-legislative side, we'll continue to engage with our partners and other stakeholders to address the threats to our programs, which we've reiterated multiple times. Next slide. Okay, so that was all that we had under all 4 of our goals, and we can pause for questions, I think.
I will add also, like we said earlier, this document is going to be probably updated a couple of times throughout, or the agenda our legislative agenda will be updated probably throughout the session. That's a process that will happen primarily in the policy committee. So if anybody here is not attending those meetings and would like to, our next meeting is, we meet every other Tuesday at noon. Our next meeting is on the 20th, and I will put my email in the chat if you would like to get added to that invite. If there are no questions, I guess now is a good time. I motion to accept this policy agenda.
I second that motion.
Thank you, Hawa and Max. And before we move on, we want to give an extra special thank you to Max, as this upcoming session will be his last as Policy Committee co-chair. Max has played a critical role the past few years in keeping the work of our Policy Committee going strong and in continuing to steward the process of developing our policy agenda through maintaining connections with member organizations and give them opportunities to bring their policy proposal to our larger group so that we can build solid alignment around so many important healthcare issues. Thank you so much, Max. And passing it to Carey.
All right, thanks, Paul. Now that we get to our main task tonight, voting on our 2026 policy agenda, conducting the vote will be Jim Howe, board member of American Federation of Teachers for Washington Retirees Chapter, and a member of HICR Steering Committee. Take it away, Jim.
Thank you, Carey. It's time for me to explain the voting. We have a quorum, which means we have 2/3 of our sponsoring member organizations who will vote on our policy priorities. Because we are meeting remotely, we will need to hold a roll call vote. We will call the name of the organization alphabetically and its designated voter. We know that some members, Larry, there's a slide. We know that some members may need to abstain or decline to vote in favor or against a particular issue because they or their national affiliate have not endorsed particular bills. So the choices you will have to vote are yes, yes with an exception, no, or completely abstain. Finally, we want to make sure to say that we know that some of our member organizations do not have the scope or capacity to work on all of these issues in our state and federal platform. The value of our coalition is that we are stronger together and can bring our combined voices to advocate for our common purpose. In that spirit, we hope our proposed platform meets with all of our members' approval. So voters, again, I'll read the organizations alphabetically. Please unmute before it's your turn to vote and be sure to mute afterwards. Members, you may switch to speaker view on Zoom to see the voters as they come up here. So there has been a motion and a second, and traditionally we do not call for discussion at this point because so much of it has taken place in our policy and steering committees. So we will begin the vote count. And the first one alphabetically is the American Federation of Teachers. And coincidentally, I am the designated voter for that. And AFT votes yes. Next up, we're looking for the Asian Pacific American Labor Alliance, AFL-CIO, and Amy.
Apollo votes yes.
Then the Asian Counseling and Referral Service, Joseph Lockman.
Hi, that's me. Asian Counseling and Referral Service votes yes.
The Backbone Campaign, David McClanahan.
The Backbone Campaign votes strong yes.
The Coalition of Black Trade Unionists for Puget Sound, Claude Burfict.
The Coalition of Black Trade Unionists vote yes.
The Children's Alliance, Max Lau.
Children's Alliance votes yes.
The Community Health Network of Washington, that's Hawa Elias.
We vote yes, and with an exception to some components of the universal healthcare bills.
Thank you. The Economic Opportunity Institute, Sam Hatzenbeller.
Hi, Economic Opportunity Institute votes yes.
The Faith Action Network, I don't believe Christian Ang is here. Is Christian here? Okay, we'll move on to the Healthcare for All Washington, John Sobek.
Healthcare for All Washington votes yes.
Lilo, the Legacy of Equality, Leadership, and Organizing, Ricardo Ortega. We will vote yes. Yes. The League of Women Voters of Washington, Katie Johnson. Is Katie Johnson here?
Yeah, sorry. Yeah, League of Women Voters votes yes.
Okay. Machinist District 751 Retirement Club. I did not. Is Tom Lux here? Yes. Is Tom Lux here?
Yes, we vote yes.
The National Organization for Women of Washington, France Giddings.
I believe that our organization would vote yes.
The North Shore Progressives, Maureen Bricklund.
North Seattle Progressives votes yes.
The Northern Health Law Advocates, Northwest Health Law Advocates, Emily Bryce.
Northwest Health Law Advocates votes yes.
Pacific Islander Health Board of Washington, Lai King.
Pacific Islander Health Board votes yes.
Physicians for a National Health Program, Washington, David McClanahan.
Physicians for a National Health Program, Washington votes yes.
Pride at Work, AFL-CIO, Mike Andrew. I did not see him. Is Mike here? Okay, we'll move on to Pro-Choice Washington, Gabby Nazari.
Pro-Choice Washington votes yes.
Puget Sound Advocates for Retirement Action. I believe it's David Loud.
We vote yes.
Right. Real Change News, Shane McComber.
Real Change News votes yes.
I didn't see Retired Public Employees Council of Washington, Elliot Weinstein. Is Elliot here? Okay, we'll move on. And lost my place. Save Secular Health Care Washington, Dennis Barnes.
Save Secular Healthcare votes yes.
CMAR Community Health Centers, Nick Ramirez.
CMAR votes yes.
Seattle Indivisible, Elise Bowditch.
Seattle Indivisible votes yes.
Seattle Roots Community Health, Brandy Taylor.
Seattle Roots votes yes.
The Somali Health Board, Muhammad Ali.
Somali Health Board votes yes.
The Thurston Lewis Mason Central Labor Council, Rochelle Martin.
Thurston Lewis Mason Central Labor Council votes yes.
UAW 4121, Shane Patrick.
UAW 4121 votes yes.
The Washington Community Action Network, Juwairaya Sheikh.
Washington Can votes yes.
Washington Federation of State Employees, Reef Landrum.
WFC votes yes.
Washington Insulin for All, Jennifer Perkins.
Washington Insulin for All votes yes.
The Washington Working Families Party, Vanessa Clifford. I did not see her. Is she here? Okay, I'm going to move on to the Washington Poor People's Campaign, Ming Chen.
Washington Poor People's Campaign votes yes.
The Washington State Alliance for Retired Americans, Jackie Boschak.
Wasara votes yes, except for the provisions regarding federal bills regarding Medicare for all.
Yes, with an exception. And Whole Washington, Andre Stackhouse.
Whole Washington proudly votes yes.
Okay, if you will give us some time, we're going to count the votes. Okay, we're ready to announce it. We had 33 of our 38 members here and voting, which is almost 90% of the eligible voters. The results were 33 yes in favor of the motion and 2 yes with exceptions. So the motion passes.
Woo! Thank you, Jim, and thank you, Hicker. We are thrilled by the overwhelming passage of our policy agenda once again. Now, for our call to action, calling John Godfrey.
Thank you, Paul. Hi, everyone. My name is John Godfrey. I'm Program Manager for Washington CAN and co-chair of the Healthcare as a Human Right Organizing Committee. Thank you tonight for standing in solidarity on so many integral issues within our policy agenda. Every item will make a difference, and so many organizations voicing support helps all of us. And on that note, I want to bring everyone's attention to our call to action for the evening. In the chat, there is a link for an organizational sign-on letter. For each of you joining us on behalf of an organization, please review it and sign on as your org is ready. Our purpose is to urge the legislative budget writers' strong support for a budget that protects and invests in essential health and human services for all Washingtonians. We need the legislature to stand strong on healthcare, housing, childcare, and food access because these are all interconnected. So please sign on and share with as many organizations as you can. We are aiming for hundreds of organizations to sign on, and we need your help to get over the finish line. We're asking you to use the same energy of powerful rally chants to make our voices heard through signing on with your own organization and particularly organizing as many other organizations to sign on as well. Thank you so much, everyone.
Now it's time for good of the order. I know a few organizations that want to share. We can call on others after that. If you want to raise your hand to add to good of the order, please keep what you're sharing to no more than a minute, less than a minute. We do have a little bit of time, but keep it short. We want to make sure there's room for everyone. So again, less than a minute. Please do, if you're sharing, add links to the chat so folks can find the information that you are sharing about. I think I could start with Cello. I know that she has a couple of good of the orders to share.
Yeah. Hi, everyone. Happy New Year. The first good of the order is North Seattle Progressives is organizing a festival of activism on January 25th at Shorewood High School. The link is in the chat as a tiny URL. Please come join us. The second is Whole Washington will be organizing a day of speaking to your legislators on
12th of January.
We just put in a permit to meet on the North Lawn. Please keep your eyes open about the email. Thank you very much.
John from Healthcare for All Washington was hoping to put a plug in for the second Wednesday speaker series. Go ahead, John.
Yeah, thanks for calling that out. Yeah, we're going to be going over our legislative priorities, which is going to be a work in progress throughout the week. Our meeting is on the 14th, and we really won't know what's kind of going through the legislature, what we're going to be supporting until probably Friday the 9th or Monday the 12th. But join and lend your support.
All right. And then PNHP has a monthly meeting coming up. David, you want to speak to that?
We have the third Wednesday, we have our monthly meeting, and we're going to have Steve Kemble from Hawaii, who's an expert in deprivatization of Medicare. So we're going to be focusing on that and how much money all the states could save, including Washington State, and would really help us with our budget. I'll be sending out a link for that pretty soon.
Awesome. Next on our list is Paula. You have a banquet coming up. Is there someone who wants to speak to that?
I can speak to it. We're going to have our annual banquet on April 17th, so please keep a lookout for more information. And if you're interested in attending the banquet.
And then Washington Can had an update about Martin Luther King Day and their lobby day. Someone from Washington Can.
Yeah, so Washington Can will be having our lobby day on Martin Luther King Day. Big part of that will be discussing and lobbying for our healthcare policy agenda. So if anyone here is interested in attending with us, please reach out to me.
Okay, and then hands from the crowd. Andre, I think I see yours. Go ahead, Andre.
Hey everyone, I just wanted to give folks a little update on the Patients Over Profits pledge from National Nurses United. As we go through some really significant changes to the healthcare system, we have to acknowledge the role that money in politics plays and the power of the political lobby in Olympia. And this pledge campaign gives any elected official or candidate for office a way to step forward and show some leadership on this issue. And I'm very proud to report that at the Well Washington Fund launch event, I was able to ask Representative Sean Scott if he would take the pledge. And the website has been updated. So you can now see Sean Scott as one of the signees of this pledge. And he becomes only the second member of the Washington legislature to take this pledge, the first being Representative Daria Faravar. So I just wanted folks to be aware of this pledge and who knows, maybe even make an ask when you're out there.
Thank you. Emily Bryce, I see your hand up next.
Thank you. Well, very briefly, thanks. Great meeting. I just wanted to add a little bit of context on the budget letter that was our action for this evening. Some of you may be looking at it for the first time and wondering why in this Healthcare as a Human Right Coalition do we also have language about housing and food and childcare and TANF. And just for those who are wondering that, wanted to share that that letter was developed in coordination with representatives of advocacy across all of those essential health and human services sectors, because we have seen in past sessions that sometimes we get divided and sometimes it becomes like a turf thing, like okay, you can cut from housing, but not from health or not from food. And that is one of the ways that they get us down and they divide our movements. So we saw last year was really effective for all of the human-centered advocacy organizations to hold hands and insist that the legislature take a stronger approach and really invest in people. So that's a little bit more context on that approach, and again was developed in coordination with core advocates from each of those sectors. So we're confident that we've got the right things to be called out in that letter. Thanks so much.
All right, thank you, Emily. That's appreciated context. Anyone else for good of the order?
So the Washington Federation of State Employees and other unions are having a rally in Olympia at the Capitol on February 10th for progressive revenue. So anyone who would like to join is welcome to do so.
Great. And please do toss a link to any information you have in the chat. We can include it in the Hicker newsletter. I'm sure Nathan will do that. All right. Anyone else? Okay, great meeting, everybody. Thank you so much for being here. Congratulations on passing our 2026 policy agenda.